Hi, this is Soumya and here we will discuss about Isotretinoin. So the video will be divided into three sections. The part 1, we will discuss about Isotretinoin, its complication, its side effects, who are the ones should refrain from Isotretinoin, and the ones who should enjoy the medications and exercise. The part 2, we will discuss about my journey with acne and Isotretinoin. Does it really help? The part 3 will be about cumulative dosage and how one should calculate it. So this will be part 1. So without any further delay, let's discuss about what is Isotretinoin. So what is Isotretinoin? The one who is suffering from acne, pimples, comedone have listened the word retinoids. And retinol is present in our body naturally in very significant amount. So what is retinoid? It's kind of retinol. So is Isotretinoin. It's a derivative of vitamin A. But the difference is, we have only used vitamin A, which is retinol, on our topical area, which is epidermis of the skin. So will it be fine taking Isotretinoin? I guess the answer is yes and no. So we will discuss in detail about this. So the go-to medication for any kind of acne are generally recommended, depending on the different forms we take, maybe in serums and moisturizers, as a medication or as a topical medication. Why it's so dangerous? Because it's a high risk medication. What you are applying over your skin is extremely different when you are taking in a capsule form. So if you have ever applied retinol 0.025 or 0.5%, you have seen your skin has changed completely. It has become flaky, dry. So for experimental purposes, if you are having mild acne and you can get rid of acne with topical medications or antibiotics, I think you should be on those terms, on those medications. Because this Isotretinoin is the last resort to people who are not benefited by any other medication or any creams or any face cleansers, anything else. So it is usually the last resort to people who should take it. These are usually taken by people who have squamous cell carcinoma, which is a skin cancer condition. It usually prevents multiplication of the cells. So they are recommended these medications. And the people who have rosacea or acne vulgaris, cystic acne, or cystic nodules, or any kind of skin allergy related to comedones. So any women or any man can take it. The answer is no. So let's discuss about who or should not take this medication. So you can pause this video right away. Number 1, the people who are suffering from diabetes mellitus, type 1 or type 2. Any person who is suffering from any of these two should refrain from this medication. Why? Because already diabetes slow down the healing process of your injury. So vitamin A, and vitamin A decreases the RBCs and WBCs in your bloodstream, in your body, in your systematic system. The number 2 is pregnant women. Mark my words, if you're pregnant, don't take it. Don't take it, not a single capsule. A single capsule may be dangerous to your baby. Either the baby will be born with birth defects or Down syndrome, or it may cause their death too. So it's so serious medication. Again, I'm speaking, it's a high risk medication. It's no kids play. It's no paracetamol. High risk medication. One capsule can change your condition if you're pregnant. So if you've already taken it, please consult your gynecologist. Or if you're going to plan a baby, you are doing family planning and you want to take this medication, so first plan your course, consult your dermat, then go for family planning. Suppose you are taking it now, you are already taking it and you were planning for a baby, you are doing family planning. So wait, suppose you have taken the medication for 6 months, so you better wait for another 6 months, and next year you can plan your baby. And also please keep checking your blood reports. Number 3 is kidney and liver patients. So if you are on dialysis or you are having any kidney infection or liver cirrhosis, so these patients also should refrain from it, because this medication changes your functioning of kidney and liver. Because it's not just externally drying your system, it's internally drying you out. So it changes your whole body system. So you're already suffering from any liver or kidney infection or diseases or disorders, no need to take it. Whereas if you are anemic, so I already told you, it depletes your WBC, RBC. Sometimes it will increase your platelets or deplete. So these are two other conditions, thrombocytopenia and thrombocytosis. Suppose your HB is still anemic and you want to start this medication, I guess you can start it, but if you are 9 or below, your HB is 9 or below, I think you should not. Consult your nearby physician or dermat, then decide whether you want to take it or not. But my recommendation is first take any iron supplements, build your RBC or iron, get a good amount of HB. Then after a point of time, after 2-3 months, you can have this medication. Then will be osteoporosis or arthritis. If you are suffering from that, you should not take this medication because this will cause severe joint pains. Otherwise, if you have gone or you are going for a bone marrow transplant, don't take this medication. So if you are somebody who is not 12 or under age 12, or you are somebody who has not hit puberty till now, so avoid taking this medication. This is not for somebody under 12. So children should not take it. If you are a teenager, you can have it and it's completely safe for you. But again, go for a proper blood test. Then you can stick to your particular dosage and start with the medication. So now let's talk about what will be the symptoms when you start taking this medications. So don't Google it. This will be my first advice because Google is filled with enormous number of side effects, and generally not everybody will have these side effects. There are so many side effects, and I think you will be so horribly terrified while searching about it that you will decide to let's not take this medication. So better is talk to your dermatologist. If he or she will find that the medication is suitable for you, they will write accordingly. And whatever the scenario is given on Google or on other sites, I won't say that don't trust them, but it doesn't happen to everybody of us. What generally happens, I will talk about it. So the general symptom includes dry skin. How your topical medication also do. So what topical medication do? Retinol generally dries your skin. But what will happen when you are taking capsule form of isotretinoin? It actually dry your whole external body, including palms, soles, dry out your eyes, your lips, your mouth, inside of your mouth. So it's just not external, it's internal too. It will dry your colon, it dry out your muscles, your nerves. So anything you think now, even your nostrils, they will be dried out. Okay, so dryness is the topmost symptom of it, which generally people go. So then the second will be blurred vision. Your vision will be blurred, especially in night time. So do not drive at night if you are taking this medication, and it doesn't happen like right away. That today you have started the medication, within 2 weeks, you started feeling you're not able to visualize something so far, or you start thinking whether I've become myopic. No, it doesn't happen like this. When you are continuously taking this medication, it may happen or it may not happen. It didn't happen. I have taken this medications. I will show you how the medication look like in my part 2. Stay away from alcohol. That is general. While you are driving or not driving, you are a teenager, women, men, anybody who's taking the medication, do not take alcohol, or take in a very limited quantity. If you are taking it, because while you are taking it, it will impact your blood test. So it won't give you the exact result what you want in your blood reports. So it can mismanage your dosage counting. Because there is no safe dose regarding this medications. Your blood reports, your weight decides your medication. Mostly it is dependent on your HB, your RBC, your kidney function test, your LFT, how your liver is functioning, and your weight. So according to that, the medication is planned, the regime is planned. Number 3 will be low RBC, low WBC, low, less or increase in your platelet count, which is very normal thing to happen. Don't get terrified due to it. It's very normal. If you're taking this medication, it doesn't like your HB is 10 today and if tomorrow after a month it will be 6. It doesn't happen like this. Maybe after 2 months of taking it or 3 months taking it, if your blood is 10, it can go to 9. That's all. It will be one thing. So either you will be having pain in your elbows or knees, or sometimes you will have pain here in your rib cage. So it's very normal. Do not stop your medication at that point. You can discuss with your dermat. Maybe he will or she will reduce or dosage or work accordingly with you. It's more like you have to be very open with your symptoms with your dermat. But don't panic on every little thing. These are very basic symptoms and they are not for forever. So my advice to you, while you are on this medication, stop going to gym because it makes your bones really fragile. So fracture may happen. So prevention is better than cure. So fifth one will be photosensitivity. So how it happens? So photosensitivity is your skin becomes really sensitive to light, especially sunlight. It gets so sensitive that even you can burn yourself. Just not tan your skin, it can literally burn your skin. So what you have to do? You have to apply a very good amount of sunscreen. Mostly broad spectrum sunscreen. You can go for hats, caps, scarves, whatever measure you would love to take. So last one would be if you're somebody who has anger issues or who is in depression, who has mental disorder, literal mood swings. So the medication is not for you. So this medication pushes a person into anxiety, frustration or impatience. Usually frustration, impatience or phobias I would say. Because your whole focus is on your skin. Firstly, it will get worse. So the purging will start. In the first 3 months, usually the purging will start. Purging means your skin will become worse. Then slowly, gradually lead you to best state of the skin. So it literally develops impatience in most of us. So if you're somebody who is already suffering from mental disorder or any kind of severe anxiety, don't take it. So these were the general symptoms which usually happens to patients. So the topmost ones are photosensitivity and the dried skin. So now what you can use to prevent these side effects. Number one is always use a sunscreen which has SPF 50, which is a broad spectrum sunscreen. Always hydrate yourself. Keep hydrating yourself. Drink 12 to 15 glasses of water daily. Like water is everything. Hydration is the key. If you want lesser symptoms, only 1-2 symptoms, please hydrate yourself. Number 3, keep a good quality of lip balm as it will chap your lips totally, completely. Don't go through any procedure when you are on this medication. Not even waxing, because your skin is so sensitive at this moment that it can peel off your skin literally. So don't go for any peeling solution that could literally take your skin off. No any procedure, no lasers, no waxing. You can go for threading or shaving, but no waxing. Say no to waxing. Get a good quality of moisturizer. Good quality moisturizer which is non-comedogenic. Next will be Vaseline or Aquaphor. I think Aquaphor will be better than Vaseline. Vaseline is a good quality. It depends person to person. If your skin texture is already dry, so you can choose Aquaphor. Aquaphor is an emollient plus opulent, whereas Vaseline is just emollient. So Aquaphor will help you. Have fatty diet. Yes. Take lot of oil. Drink lot of oil. Eat lot of oil. So basically have lot of food which is carbohydrate rich or fat rich, like groundnut, olive oil, food that contains lot of ghee. So basically have a fatty diet. What you should not have during this period. Any procedure, laser, vaccine, and if you're on any medications like Absorica or Amiron, these are iron supplements. So any kind of iron supplements or vitamin A, stop it right away. Because retino is also this isotretinoin or is also known as Accutane. So these are vitamin A only. So it will raise your vitamin A level. So you will start bleeding from your rectum area. So better don't take vitamin supplements because it will inflate your vitamin A quantity. So better don't take it. Also it will make your blood thinner. So don't take it while you are on isotretinoin, or choose any of the two. First to complete your vitamin A especially. You can take multivitamin with it, no problem, but not vitamin A. So first complete your vitamin A course. After 2 months start your isotretinoin, or first to complete your isotretinoin. After a point you can start your vitamin A course or your iron supplements, whatever. So don't take it together. So lastly, I would love to tell you that it's a great medication if you are suffering from acne or pimples or washing, but it can be complicated at times because it can also lead to severe complications too. So don't start it on your own. If your dermat is not recommending you, you can also talk to your dermat that nothing is helping me out, I want to be on isotretinoin now. So you can get to this medication. So it's a great medication if taken in respectable consideration. So let's meet you in part 2. Before that, subscribe to my channel and hit the like button. For more such videos, please stay tuned.